Hi. This is in reference to the first speaker, when you did your study out in California. I think that that study is lacking and that it doesn't address whether the participants have a relatively adequate income and whether they're low income. It makes a difference in terms of transportation, what you can and cannot access if you do or do not have the money. And that's where I think we miss out on addressing all the needs related to transportation.
Thank you.
I don't hear it. This was working.
Now,
Now, there you
yes,
go.
okay. Just to clarify, it's gone off. Can you hear me?
Yes, I can hear you.
Here, I'll let you this one.
Just keep going on. Yeah. The study was not done in California, it's in Detroit and Dallas, but we also did ask about income. It's just something that I didn't put up in my presentation. So, because it's a community assessment, we did ask about income, and all of this data has just come in. So I quickly pulled the data for the older adults, but we also have information on income and any NEMTs. So non-emergency medical transportation, if they have that, if they don't have that, so we do have that information to analyze as well.
But money makes the difference.
I agree.
Yes.
I absolutely
All
agree.
the way through.
Yes,
Sure.
absolutely.
As you work through the auxiliary accessory, have you developed a draft planning ordinance to help the planning commissions adapt the zoning rules that are out there? Each one's different, that's true, but have you done a draft that they could work from?
Not personally, I'm working on policy evaluation, so policies that are in place. There's a number of them for Michigan, actually, there's like a state level plan for aging in place, and housing is part of, those components. I think it'd definitely be interesting to evaluate the text of those ordinances, but there's certainly good and solid efforts in place, definitely for East Lansing, right? ADUs are already considered part of what you can do and apply for permitting. And so I think we're definitely moving in the right direction, but I personally am not writing ordinance language at this point.
My question is about some of the demographics of the homeless population. I don't know if any of you can speak to this, but among the aging population, how many are veterans? And what is the gender distribution of veterans? Because as difficult as it is for male veterans to access services, women get further left behind. So I'd be curious, in particular, if you have any data on that.
I don't have the exact numbers, but nationwide, veterans are a substantial component of the unhoused population. It's mostly male, mostly in our community, mostly white folks. And this is we had actually made strides in veteran homelessness during the Obama administration. It came down almost to like just 6%, which is like unheard of. But during the first administration and during the Biden administration and now the second Trump administration, those numbers have started to go up again. And so that's very unfortunate. So one of the things that us as a group, we are okay with housing some people that we see as deserving. And so veterans are certainly one of those groups. We also see children and moms and children as deserving. And so this is where single men are having a really hard time finding housing, and a lot of them are veterans.
Ben Marta?
Hi, I'm Marna Wilson. I'm a member of the Meridian Township Board governing body. We instituted an ADL zoning ordinance almost 2 years ago. We've had a number of people take advantage of that. So if you are looking for a model ordinance, we'd be happy to share that with you. Just call Meridian Township Planning Department and they'd be happy to share it. It has been very successful and it's addressing a great need. Thank you.
About the affordable housing. Seems like the location of what was planned was rejected, not the idea of housing in East Lansing. This is what my understanding. Are you thinking about another location, maybe like more northern part where we have more land and these units are not going to be cramped like the original plan? And it would be more maybe affordable, because we know that the downtown land is much more expensive.
So this is actually something that comes up a lot. And I identify it in my work as well, where people, us, and I include myself because I'm part of society, we always say, yes, we need to house unhoused people. We just don't need to do it here. Let's do it somewhere else. And so the people somewhere else also don't want it. And so they'll say, oh, yes, we need housing for unhoused people, just not here. Let's do it somewhere else. And we continue to kick the ball down the street, and then it never happens anywhere. And so then we all complain, why are there so many unhoused people? And as a society, we also have to come to terms with the fact that there are a substantial number of folks in our community that will not be able to pay anything for their housing, and we need to be okay with this. It is a lot better for all of us if folks are not outside. And so when it comes to pandemics, when it comes to all of these things, it's a lot safer. We're protecting our own health by doing this. And so, yes, there's a lot of considerations about the value of land and density issues and all of these things. But if we continue to do this thing of, yes, we should house them, just not here, let's house them over there, or let's house them over there, then that's the process, or that's the kind of thing that we've been doing for so long that's got us where we are now.
So we don't have.
Okay, we got a couple of questions from online.
We don't have any alternative.
I mean, no, the only thing that's also on this list is housing, so we need to build it.
Okay, we have a couple of questions from online. So from Ishmael, you mentioned, Dr. Koboke, this is for you. You mentioned 90% of people felt safe, 20% did not. Do you have any other data about that 20%?
Yes, again, it wasn't here. We asked the ones that said that they don't feel safe on why they don't feel safe. And it's a lot of qualitative data, which I just didn't present here because it's fresh. That data is fresh. But yes, we asked them why. Every time they said they don't feel safe, if they don't use public transit, we ask them why. And we have a lot of qualitative reasoning behind that.
Perfect. And this other question came in, I think it's for you based upon the time. Did this research include many SES groups? And I'm not sure what SES stands for.
Socioeconomic status is what we would consider as yes. So in socioeconomic status, we look at race, income, those. We also looked at other personal conditions such as chronic conditions and things, because the overall aim of the project was transportation to healthcare appointments for those with chronic conditions. So we did look at that. Again, yes, because it's a community assessment, we do have to.
Perfect. And while I have the mic, we have one more question that came in. Do you have an estimate of how much it would cost to provide housing for the homeless population of East Lansing?
I don't have a number for East Lansing, but study after study shows that housing all of our unhoused people is cheaper than what we're doing now. Because right now, they go to seek emergency services that they can't pay for, that our tax dollars end up paying for. We pay for the cops that arrest folks, we pay for the jails that they go to and the food that they're eating there. And so all of those costs put together are more than us housing every unhoused person in our communities. In addition, I always say that the only thing that solves homelessness is housing. And we have this idea that we have to build a ton, but we have more empty houses than unhoused people in this country. And we really need to change the way that we think about property in order to solve some of these issues. The problem is that our housing market is segmented. We have a lot at the top and not enough in the middle and the bottom. And we need to, we also as Americans don't like the idea of public housing because we've never done public housing in a right way in this country. From the very beginning of the 1930s, as they were writing the legislations for public housing, the senators were discussing how they didn't need to have anything pretty. Because obviously, poor people don't deserve to have nice homes. They wanted to limit the number of windows that they had. And so then we stick a bunch of people in these cubes with no windows and don't give them money for maintenance and then wonder why it was a disaster. And so one of the things that I think we should look at is public housing that benefits the middle class and folks who are lower income, because we all need help with our housing, especially during these times. And once the middle class is involved in an entitlement, it doesn't go anywhere. Think Medicare. And so we do currently actually have, and I like to point this out to people, like public housing program that works really, really well. And it's a public housing program in that we use public money to help people with their housing. And that is the mortgage interest deduction.
That's right.
And that only benefits homeowners. That benefits some of the higher folks in our society. It doesn't benefit anyone else. And so we need to change the way that we think about property and public housing and who's getting access to what. And so currently, folks who own homes are getting public assistance for their housing, and no one else is. And so maybe we should help other folks as well.
We have a question here.
Hi, good morning. Thank you for your panel. My name is Mary, I'm also from MSU. And following up on that question, thinking about making the case to our legislators and the recent change in the administration and the focus areas less on community and more on economics, we really have to make the case for the economic impacts, particularly vulnerable seniors. So how has anyone looked at that and the implications for also circulation of local dollars and what's being added especially in the Lansing area?
I'm not sure. I know Rex is sometimes does this. You do some of the circular economy stuff, but I don't think anyone's done that study here in Lansing. But you can find others where communities have. When I was in graduate school in Orange County, they did a big study. One of my advisors did a big study that showed that it was in like the billions with a B, that they would save if they housed folks. And it wasn't limited just to older adults, it was the whole population. But older adults end up in the hospital a lot when they're unhoused because they fall, because they are, they have dementia, because all of these other issues.
So I'm from Rex's group. I'm see you tomorrow too, by the way. Okay. So we need to drill that down then as far as trade-offs with housing and economic impact particularly. And I hope that we can pursue that. Thank you.
Okay, we have one more comment and then we'll go over.
Yeah, I have a comment, ask question. My research at the University of Maryland, we did some research best practices of communities overseas and how it's just why don't we take some of the examples, such successful examples of other countries that are how they treat their odor and housing and the complexes that look fabulous, especially the one in Singapore. But it's something to look into. I hope that you're doing that. Thank you.
So, yeah, that was not quite a question, but I'm so glad you brought that up because that was in my mind, right, as Dale was answering the question, and I think there's something of a reluctance in these communities to look at other examples, right? But as someone who comes from a different place, so we do that a lot, right? We look at other examples. There's a host of fantastic projects that are meant to house lower income communities. Singapore's public housing it's beautiful, right? But in South America, Chile has this fantastic program where the house is built like half of the house because the notion is that it is your house and it should grow how you want it and when you want it, right? And so there's this possibility of thinking of even how the house looks that is different, right? And it moves us away from this static notion of property, of income, of even, and I would go a step further, right? And not just rethink housing and housing everyone, but also rethink the role of the cities and the state and the government, right? It is the role of the state to provide, right? That is exactly why humans created and made up states, right? Because we made up taxes because the idea is that they should come around and they should benefit us all. And there's beautiful projects out there, they're very successful. And I think more than how they look, they are great examples of a shifting mindset around housing, state, government, policing, and a host of other topics.
And also in some of the the Netherlands, for example, and some of these European cities, you have also public housing that benefits everyone in the society, including the middle class, and so these models have worked there as well. Although nationwide or worldwide, there is a housing crisis because of speculation, and some of these countries also have a growing unhoused population because of the commoditizing of housing worldwide. And corporations like Blackstone literally purchasing every single vacant house in the world.
We're going to take a short break. Thank you so much to our panelists, our researchers.